So good afternoon, ma'am. I'm Ruby Ann, your student nurse for today. So I'm here to assess your abdominal, okay? So are you comfortable with your position? Since the client says that she is not comfortable with her position, we will have to put a blanket over her and the pillow. Yeah. In assessing the client's abdominal, we have to do a visual inspection. Okay, so we have to observe the client's abdomen. We have to note for the skin color, for the size, contour. So the client has a normal size, shape, and contour. Her abdomen is pretty symmetrical. There's no any discoloration on the client's navel or umbilicus. There's no presence of any skin lesion or striae. However, the client has a insect bites on her abdomen. In overall, the client's abdomen is normal. Okay, so next we will have to measure the abdominal girth of the client. So using this measure tape, we will put it over the client's body, starting from the umbilicus line. Okay, ma'am, can you raise your back? So the client's abdominal girth is 75 centimeters, which is normal for a woman. The next thing is auscultate the four quadrants, including the aorta, renal arteries, iliac arteries, and the femoral arteries. We have to start from the right lower quadrant. Stomach growling, or also known as borborygmus, is normal when you're hungry. However, constant, continuous bowel sounds indicates gastroenteritis or early stage of abdominal obstruction. Absence of bowel sounds for 5 minutes is a sign of abdominal obstruction. So all in all, the client has a normal bowel sounds, which sounds like a high-pitched gurgling. So in doing percussion, we always have to start on the right lower quadrant, going down. Then you have to repeat it on the left lower quadrant. So upon percussing the client's abdomen, you will be hearing a timpani sound. So now we're going to percuss the client's liver. So the client's liver is 4 inches, which is normal. So now we're going to percuss for the client's spleen. Ma'am, can you face on your right? Normal, so the normal sound for percussing the spleen is tympani, which I heard on a client. But however, if it turns dull, it may suggest splenomegaly. So now we're going to palpate the client's abdomen. So using your finger pads, depress it gently on the client's non-tender quadrant. By doing a deep immersion, okay, then now do a deep palpation. So there is no tenderness or mass on the client's abdomen. So now we're going to palpate for the client's liver using a hook method. Take a deep breath in. Okay. So next is to palpate the spleen. So take a deep breath in. So now we're going to palpate the client's kidney. Ayan. Okay, inhale. Inhale. Exhale. So now we're going to do the Blumberg sign. Do you feel any pain, ma'am? No. Okay. So next is the Murphy sign. So we have to put our fingers on the client's gallbladder. Okay. And ask the client take a deep breath in. Do you feel any pain? Okay. So next is the ellipsoid test. Ma'am, can you raise your right leg? Okay. So I will push it. But I will push it down. You will have to resist it, okay? Can you raise your right leg? Do you feel any pain? So next is the Boltzmann test. Okay, please raise your leg. Resist it again. Then quickly put your fingertips on the client's gallbladder. Do you feel any pain? So next is the Mockberg sign. It is located at the anterior superior iliac spine. Do you feel any pain? So all in all, the client has a normal abdomen.